Okay, everyone, all of our panelists are here, so we're going to go ahead and get started since we are at the 6:01 mark. Just as some introductory stuff, my name is Victoria Saucedo. I am the current Chief Financial Officer and Treasurer for the Judy Nicholson Foundation. And tonight, this is our Young Voices on Kidney Cancer panel that we are hosting for the month of March. Some of you are new here, some of you are veterans and come to a lot of our programming. Regardless, we are excited to welcome everyone tonight to our panel. And we'd especially like to extend a thank you to our two sponsors for tonight, which is Merck Pharmaceuticals and Exelexis. They provide a lot of support for our foundation that allows us to host educational programs like this panel tonight. So I'm going to let our four amazing panelists introduce themselves. And just to give an idea of the unique perspectives they bring, let's go ahead and start at the beginning. If each of our panelists can briefly share their journey about kidney cancer, we'll definitely get into some more specific questions to later on tonight. But I'd like to just hear how you were diagnosed and maybe a little bit about the challenges that you have faced as a young person experiencing kidney cancer. And Katie, would you like to go ahead and start us off with this question?
Sure, I'd love to. Thanks for having us on the panel as well, too, and helping coordinate this. So my name is Katie Coleman. I was diagnosed with a ultra-rare stage 4 kidney cancer a little over 4 years ago. At the beginning, we thought that it was possible that it could have been a chromophobe kidney cancer. I had about a 12-centimeter tumor on my right kidney and about 15 or more tumors in my liver. So stage 4 and things didn't look so great at the beginning. That tumor that I had actually ended up coming back as a oncocytoma, which is typically known to be a benign tumor that pretty much never ever spreads. Mine is the one that did not catch that memo when it went to my liver, which is what gave me a stage 4 diagnosis. That made treating my case very difficult because there's no treatment guidelines to go off of. And we were just going with whatever we thought might best fit the biology. So I was on treatment for a very short period of time. I was on a TKI for about 2.5 months before eventually I was put in touch with the NIH and the National Cancer Institute, where they had a protocol for me at their clinical center in Bethesda, Maryland, where a team of doctors was able to take a chance on me with a very large surgery. So about 6 months into my diagnosis, we removed my right kidney. We did 5 wedge resections of my liver, burned 10 tumors in my liver during that procedure as well. And then a few months later, we went back and burned a few more. Since then, I've been off all treatment and currently have no active cancer. So I know what it's like to be diagnosed and told that as a stage 4 patient, there's no curative options. At least in my scenario, that was some of the early conversations. And then to have my prognosis really pivot. So it's been a little over 4.5 years, or coming up on 4.5 years since I was diagnosed. And I've pivoted my life because of that as well, too. So I now have a nonprofit in the space, the Chromophobe and Oncocytic Tumor Alliance, where I raise funding for chromophobe kidney cancer and just trying to spread awareness and make it better for patients that come behind me, hopefully.
That's great. Thank you. Janelle, would you like to go next?
Sure. Hi, I'm Janelle Moxley. April 2019, I went to the ER. I had very bad flank pain. They took a CT scan. They found a 22.5 centimeter cystic mass. So in May of 2019, they took out my right kidney at a right radical nephrectomy. I didn't know until 2 weeks after it came out. So mid-May, it was actually cancer. It came back as papillary renal cell carcinoma type 2, stage 3, grade 3. So that was at 30 years old. And then I was on surveillance for a little bit. And then in August of 2020, I had a biopsy. It came back to my lymph nodes. After it came back to my lymph nodes, I went on Opdivo and Yervoy. So 4 rounds of Yervoy and then Opdivo. And I continued that for a little bit over 2 years. So I did that from September 2020 to February 2023. And I had actually stopped in the middle of it. My complications with it were skin toxicity. I became very rashy. I had marks all over my body, almost like I had chickenpox, super itchy. And it ended up, I had to go to light box therapy with my dermatologist twice a week to control that. But as of now, and after the immunotherapy, it did work for me. I had a full response to it. And I've been NED since about spring of 2021. So now I'm only on surveillance and I get scans every 6 months. And I actually had a baby in December of 2023 after I finished treatment too. So that was amazing to be able to do that after everything.
That's great to hear. Thank you so much. Anna Maria, would you like to go next?
Sure. And I do want to apologize. I will have a cat interrupt his entire conversation.
worries.
It is raining here in Austin and he is not a fan. So he gets very cuddly. He's on my lap right now. Hi. So I am Maria Scaccia. I was diagnosed with Parenthood renal cell carcinoma stage 1 in late September 2020. And then I had a radical nephrectomy on my left side in October 2020. Because it was stage 1, I didn't need any other treatments, but I've been on active surveillance since and get scanned and a chest x-ray every year. In terms of impact, I'd say one, being a young parent, I was 37 when I was diagnosed and my son was 5 at the time. And so that's had a huge impact on me being a young parent and trying to figure out how to parent while at the same time take care of my health. I also think being taken seriously has been a huge issue for me, both because of my age and because of my stage. I think a combination of both. It's been very much treated as if I am fine. I am NED for kidney cancer, but I also was diagnosed with papillary thyroid carcinoma 2 years later. And that was like by the age of 40. And then this past fall/winter, they found a precancerous polyp. So I'm in a high risk, intermediate to high risk for developing a third primary, which would be colon cancer. So I'm not actually fine if you think about it, but because of my age, because of my stage, because of the way I look, and now I have dogs harassing me, that's also a huge problem. Yes. Hi. Right. But yeah, so that I would say that's where I'm at.
Great. Thank you all for sharing those brief yet powerful introductions of what your kidney cancer journey has looked like so far. Building on that, I'd love to explore how your age has played a role in shaping your experience. I know a few of you have touched on that, but I'd like to take this opportunity to go in depth a little bit more on that. So if y'all could share how your age influenced anything like your treatment options or experience with healthcare providers, and what are the unique challenges or benefits that you felt you experienced as a younger person with kidney cancer? Sid, would you like to kick us off for this question?
Yeah, definitely. Also, I'll introduce myself too.
I'm so sorry. I accidentally skipped you.
But yeah, it's also, if you hear a crying baby in the background, that is my new baby who has been here for all of 2 months. I apologize for that. My wife is doing great work in the background trying to calm her down. My name is Sid Sadler. I was diagnosed a little over a year ago with I had approximately 10.5 centimeter tumor on my left kidney. I had a radical left nephrectomy, and I was diagnosed with stage 2, grade 2 clear cell renal carcinoma. So I'm on active surveillance as we speak. I got moved up to 6-month scans. I was on like 3 or 4 month scans, and now I'm on 6-month scans. So I'm happy to hear that. And then as far as just being a young adult being diagnosed with kidney cancer, I was actually speaking to somebody earlier today, and they asked me the same question about just how is that feeling? And I think one of the words that came to mind was just isolation, because I think when you're diagnosed and you like Google this cancer specifically, regardless of subtype, it's usually affecting folks that are 50, 55, 60, 65. So it can be a little isolating. I think that's why a lot of us here on this panel probably know each other outside of this as well, because we generally tend to pick in groups and talk to folks that are going through the same thing as us. So yeah, Victoria, can you please repeat the question? What was the question? I'm more than happy to answer it.
Yeah. So how did your age influence treatment options and your experience with the healthcare providers?
Yeah. So I'm a little privileged because I got lucky. The healthcare providers that I had starting out with my diagnosis, and actually the doctor who ordered my CT scan, took all of it was honestly the reverse of what Anna Maria was talking about. Very quickly, I was put in for a CT scan after I had one symptom. My symptom was blood in my urine. And very quickly I got a CT scan and they were like, you have a tumor. We're going to take you to Vanderbilt. And within a month we were talking about next steps. As far as my age with this cancer, I think one of the things that I talked a lot about with my doctor was, or at least one of the questions I had a lot going into these meetings was, do we have to take my whole kidney? Because I'm 32. I was 32 when I was diagnosed. So I was 32. Do we have to take my whole kidney? I have hopefully a long time to live. Is that something that we have to do? And I was told very surely, with the size of my tumor, we're definitely looking at a radical nephrectomy without the possibility of a partial. That conversation was happening. And one of the conversations I wish that happened, because this was before my daughter was born, was if we ever do go down the road of treatment, if I need adjuvant therapy after my surgery or anything like that, does that impact at all us trying to have a child? Because my wife and I were literally planning on trying to have a kiddo in December of 2023. And that's when I was diagnosed. That's one conversation I wish would have happened, or at least poked and prodded a little bit. I never brought that up to my doctor, but I would say those two things probably were going through my head the most when those first meetings were happening after diagnosis.
Great. Thank you so much for sharing that. Katie, would you like to answer the next question regarding the age influence?
Well, I feel like there's so many avenues to talk about on this question. You could explore this question alone for probably an hour, but I feel like there were pros and cons personally. I had a lot of the same experiences of being young that kind of a lot of younger patients do, especially younger women that take a long time to get diagnosed. It took me a year and a half to get diagnosed. Everybody just thought I had anxiety. My memoir is titled Too Young for Cancer because I was told that several times as I was trying to find out what was wrong with me. And it's really disheartening as a patient. I had this really conflicting feeling when I was diagnosed. One, that I was very shocked that the very first emotion that I had when I was told I had cancer was relief. I was told I had cancer and likely an advanced stage cancer. And I was in the ER, and the very first thing I felt was, wow, somebody finally believes me. I knew something was wrong. And then to touch on what Sid said of isolation, there's this feeling of, for me, I felt already isolated leading up to my diagnosis because everybody kept telling me like, no, nothing's wrong with you. You're fine. Where I knew something was wrong. And then I got diagnosed in the middle of the pandemic. And so I moved across the country away from my family to pursue treatment. My husband wasn't allowed to come with me to most of my appointments. And so there was and while my case was very unique, I think it very much was compressed in the social isolation for that. There was also a lot of benefits that came out of that. Being younger, I did turn to social media. Anna Maria was one of the first ones that I connected with. And if you look at the little group of us that all connected around the same period of time when Anna Maria and I connected, we really built a really strong community of support with each other and are all very active advocates now and helped raise funding for grants and started different initiatives. And so there's both this isolation from the world you used to know or your peers, maybe, but there's also an entire community that you gain in the process. And so I feel like those who choose to get involved in the community and connect with others, there's just this unspoken bond that I feel the same with older folks that are diagnosed with kidney cancer as well, too, but especially younger patients. And then I'll just touch for a second on the medical system side of it. Before, I felt like my age was definitely working against me before I got diagnosed. I do think that it also helped me after I was diagnosed because it did open up more options for me as far as the surgery that they did on me, they probably would have never done on somebody twice my age. And so there were some things that it was to my advantage being slightly younger, but there's definitely a lot of really unique challenges of, especially after you get through the acute period of treatment of what does life look like now and how do you return to normal after you've gone through something like this at a young age.
Great. Thank you. Janelle, would you like to go next?
Sure. So I kind of had a similar experience as they all have had. I was told a lot of times I went to the urgent care when I had flank pain or I knew something was off with me, that I pulled something in my abdomen. I was just brushed off. And even until the surgery, they just kept saying, it's just a cyst. You're fine. It's just a cyst. We'll treat it like cancer, but you have nothing to worry about. So it's that I knew something was deeply wrong with me, but it was hard to get anybody to actually figure it out until I went to the ER and said, hey, there's something wrong. Can you please just do a scan? And that's when they found, obviously, that it was a tumor, not just a cyst. So just having to advocate for yourself. I also felt very alone in the whole treatment aspect when I was talking to my oncologist. Being a young female, I was married. I would just turned 30. So we wanted a family. So I was spearheading all the conversations on family planning. There are resources out there. You just really have to advocate for yourself. And I don't feel like it's talked about enough. Luckily, I was able to work with Livestrong and Heartbeat through Walgreens, and I did a round of IVF before I started treatment for fertility preservation. So that was good that I had those just as a safety thing to have. But it was more so me making those conversations because I feel like patients are usually not in the same scenario or point in their life family planning. So that was different to have to be the one to bring up those things. And as well as the treatment options, my medication, Yervoy, I was on Opdivo and Yervoy, was actually denied by my insurance. So I actually had to get that through Bristol Myers Squibb directly from the manufacturer. And I feel like maybe my age helped in that scenario. So they provided that, which was awesome because I did have a complete response to the medicine.
Great. Thank you. Anna Maria.
So I have a great PCP. And so she was the one who I had persistent back pain that I attributed to polycystic ovary syndrome. She was the one who looked at my kidney labs and said, no, we need to take you for an MRI, like for an ultrasound, and it snowballed from there. Because for her, it's like I was too young and too fit to have kidney labs the way I did. And my urologist who did the surgery looked at them and was like, no, I know it's cancer. There is so medically, like the medical system, at least with that diagnosis, it was like I was very lucky because I had doctors in the past who would not have taken me seriously about anything. I would say it was the people in my life who didn't take me seriously because of my age and fear and whatnot. So I heard a lot of, maybe it's a stone, maybe it's not this, maybe it's not that. And I'm like, no, it's cancer. Like, I know it's cancer. Like, let's just face it, it's cancer like that. Let's just move on. I think my experience with the thyroid was a little bit different then. That's when I was taken less seriously. My PCP, still amazing, didn't think anything of it, even though I knew there was something wrong. So it was more, we confirmed it through due diligence rather than anything else. And my surgeon was just an awful person, to be frank. He did it. He didn't take anything else seriously. I had to really advocate to get a whole body scan. And that's how we found out there was metastasis in my neck with the thyroid cancer, even though I was staying it for a few months. And then with the colonoscopy and then something else that I'm experiencing, there was a few rounds of trying to get people to listen to me because, again, it all came down to the age. You're fine, you're young, it's nothing, it's whatever. But I would say with the kidney cancer, I actually left down with my doctors, I would say. So
Great. Thank y'all for that. For our next question, we know that navigating kidney cancer at a younger age, like many of you touched on, means leaning on support in different ways. So for this next question, I'm interested to hear from Katie and Anna Maria about what role your support system has played in your journey, whether that's from your family, friends, or your own healthcare teams. Did you feel that being younger impacted the kind of support you received? Katie, would you like to kick us off?
Yeah. So this is a kind of, again, I think complicated question. And I think it really does touch on being younger in this scenario. I think this happens for a lot of people, but especially those who are younger, and especially of the age that you might be having families, your friends might have young families. For me, my support really came from the kidney cancer community and my husband. My parents were there as far as they were a phone call away or a text message to check in. But really, my support came from the community and my friends. I think being young, this Anna Maria touched on this. And I think it's when I think back of before I had cancer and the things that I said to people who had cancer, right? I was saying all of those things. And it's half of a reassurance. You want to comfort the other person and try to take away their suffering or their thoughts. And then I think it also comes from a perspective of people are hurt, like other people are hurt by our diagnoses as well, too. And it doesn't just affect us. And so I think sometimes when they say those things, it's a self-soothing mechanism as well, too. And so, but it's really hard when you're the person that's going through that with cancer. You just want people to be on a level playing field. And so it can go back to what Sid said of it feeling really isolating. For me, I know everybody approaches it very differently. For me, I really leaned on the kidney cancer community and honestly, my healthcare providers. I think a lot of the reason why I advocate as much as I do now, and I've become the advocate I am now, is a direct relationship to the physicians that I had, both from the care that they provided to me, but also how much they taught me in my appointments. And this very unique scenario that even, as I mentioned, being diagnosed during COVID, I very distinctively remember going through treatment, especially like in the middle of the pandemic when I had moved to a new city. I remember I didn't see anybody outside of my husband every single day and my physicians. I was still seeing my doctors every few weeks when I'd go for lab works or for scan. And they were the only people who knew what I was truly going through and actually had a general idea of what my life looked like at that moment. None of my family, none of my friends had any idea. Like they heard the highlights that I shared on social media, but didn't really know what it was like to go through that. And so I remember as I started doing better and my scans started getting more spaced out, I had this weird feeling of there's my safety net and there's the people who understand what I'm going through. And I shifted more into the advocacy space, but I think it was both a helping me through treatment, but also teaching me how to empower myself is really what helped me through those things. So I think support systems are super crucial. I absolutely would not be here if it wasn't for my husband who helped me through every step of the way. But I think support systems can look different for everyone. And just because you might not have family or friends nearby to help in the way that kind of I think people traditionally think when you think of somebody being surrounded by their family and friends around cancer, doesn't mean that you can't find support elsewhere. And again, my family and friends were there, it just not quite in the way that you might have expected with a diagnosis, given all the circumstances.
That's great. Thank you.
I'd say I'd agree with Katie on that last point. It's actually really interesting. So my older sister had cancer when she was younger. So I was way before I had my diagnosis, I was already exposed and a caregiver to someone who had cancer. But when my father passed away, we stopped talking. And I won't get into that drama, but it had been at that point when I was diagnosed by 5 years. So my cancer ended up bringing us back together, and she ended up being a massive source of support for me because I still struggle a lot with the dialectical thinking between being angry and being grateful. And so she really helped me through a lot of that. I think Katie and the rest of the Chromie Six, as we're called, they were the first people that I really connected with when I was first diagnosed. And so they were the people, even to this day, who like I go first to when it comes to any health issue or other things too, obviously. But like, anything like that. Like they're the ones I lean on because you guys are the ones who really understand exactly what I'm going through. And then I was able to really build a community with other active people who are kidney cancer survivors. So at that point, I was a kickboxer. I had a couple of friends who are still really close. We're really close today, who were in my corner from the gym I was at. And then being really into that and into lifting weights. I won't get into that whole story, but I realized that there was a very big need for people like me who had kidney cancer, who had one kidney, who was also into lifting. And so I ended up finding and building a community of us online. And so they've also been a really strong support because they understood exactly what I was experiencing with doctors who just did not understand how that stuff really works and just apply blanket rules. And again, I tend to soapbox, so I have to pull myself back from standing on that. But yeah, I'd say it was really about finding people who understood, and that if I didn't find those people, if I didn't find Katie, if I didn't find Kayla, if I didn't find Catherine, I'm going to name them all. If I didn't find Melissa, if I didn't find Tracy, you're the lovely JNF president, I think it would have been harder. I've been public and spoken about how the support system with my family had been, and it wasn't that great. And that's something that my partner and I have talked about and rehashed and spoken, and we've gotten better at. So it was really everyone in the cancer community that I really leaned on to get me through.
Great. Thank you so much for sharing all that. And thank you to Katie. For our next question, I'd like to hear from Sid and Janelle. Many young patients are juggling major life milestones alongside their treatment at the same time, like many of you have mentioned. Can y'all share a little bit how you balance the demands of treatment and recovery alongside other things you might be accomplishing and working on in life, such as education, balancing your work schedule, or just your general social lives? Sid, would you like to kick us off?
Yeah, sure. So I was working full time when I was diagnosed. And when it comes to that, I think that this is something that kind of gets lost on a lot of people. So I'm happy that you asked this question, because a lot of times when we're looking at kidney cancer, like I said, folks that are generally diagnosed with, I think the median age is 65, folks might be retired, you might be just working part-time, who knows? But usually when you're talking to somebody our age or young adults, those are my dogs in the background. So we'll just keep it going. Mom is leaving the house, so that's why they're barking. When we're talking about folks in our age range or age group, I was working full time. I was very lucky that my employer was extremely flexible with me going to get scanned, with me going to meet with my doctors, with my surgery. I was also very lucky in the fact that my surgery recovery, even though my tumor was relatively large, my recovery was within maybe a week and a half or 2 weeks. And I was pretty much back to feeling normal physically. And a lot of the work I was doing, my background and professionally is in communications and social medias. A lot of my work could be done remotely as well. But when you're looking at other things, such as like social life, I found my role kind of post-diagnosis being a little bit, not only just in the advocacy space, but also using humor to cope with things. Sometimes that makes people a little uncomfortable. So in my social life, a lot of people had to swallow that pill that I would joke around about things and that it was okay. That would sometimes make people uncomfortable. It makes a lot of my family uncomfortable, but my family would much rather just not talk about cancer. But it is what it is. I was diagnosed. So hey, it is what it is. But also something that I've noticed recently, speaking professionally, is when you're going out and looking for other jobs or maybe advancements or anything like that, does the topic of a diagnosis come up when you're going to interview somewhere? Because again, a lot of people our age are looking at maybe getting another job or advancing in their career or picking up another thing. So that's something that I found I've personally struggled with, because for better or worse, I have a digital footprint and I'm proud of my digital footprint, but it also has the indication that I was diagnosed with kidney cancer. And a lot of people, when you tell them that, even in my case, where I'm just on active surveillance, when you tell people that you were diagnosed with cancer, they just automatically assume that you're getting chemotherapy every 3 or 4 weeks and you can't do anything. They assume all these things. So that's something that I've personally struggled with, is that, hey, a year from now, if I want to go and send out my resume to somewhere, are they going to, if they're doing their due diligence, they'll look on my LinkedIn or they'll look on something else and say, oh, this is a big life event that happened for him. What about this? And we all know that when hiring, it's obviously illegal to do that, but you can only go so far when it comes to that type of conversation. So that's something that I personally struggled with, tried to unwrap a little bit post-diagnosis, I would say.
Great. Thank you for sharing that. Janelle?
Hey, so when I got diagnosed with recurrence, it was in the peak of COVID. It was August 2020. So I luckily was work from home to balance everything. I will say if you need to rest when you need it, my main things were the itching and just fatigue overall. So rest when you need it. If they have things at your work to offer you, such as FMLA, take anything that you need and don't feel guilty about it. Like you have to do what's best for you and your body. I luckily at the time had an employer. They were really flexible with me and they knew my situation. So I used to go to Lightbox therapy twice a week at my dermatologist to keep the itching at bay, as well as treatments once a month. I would just take that whole day off, use a sick day. Just for my own mental health, the infusion itself was maybe only an hour and a half that I was at the actual cancer center, but I just needed the day for myself to recover mentally and physically. I will say, to touch on what Sid talked about, if you go into looking for a new career, a lot of people at our age are trying to do that or advance themselves. I hid my diagnosis. I was not embarrassed by it, but it was very hard for me. And my way of coping with it is I kept it to myself, at least with work. I didn't want to be looked at differently. I actually switched jobs, still in active cancer treatment. I only had a few months left of treatment, I think 3 months left. But when I went into my interviews, I was just open. I just said, hi, I have cancer. This is my background, what happened. And I was just open about my whole journey. And I found a place that accepted me and they're great with me. And they let me do my surveillance scans every 6 months. They understand, they're caring. So you will find your people.
Thank you for sharing that, Janelle. So our next topic leads us into the broader question of awareness. And I'd like to hear from Katie and Sid for this next question. Do y'all think there's a need for greater awareness or earlier detection methods that are specifically geared towards younger people? And if so, how would y'all advocate for this? Katie, would you like to start us off?
Sure. And I probably will have a very different answer than I think what most people would expect, especially given my circumstances and how long it took me to get diagnosed. If you would have asked me this question 4 years ago, I would have said, yes, everyone should be screened. Like, as soon as you have a problem, do an ultrasound, get a CT scan, do it immediately. My opinion has definitely changed over the years, and that comes from learning a little bit more about diagnostics, about the risks that come with it. I myself even also had a small, benign, we don't even know what to call it. I live in the world of rare, but small benign mass that was found more or less incidentally in my bladder after my diagnosis that I had to go through surveillance for and that I had to have removed. And that might not have ever been found, but there could have been complications for that. I also had an internal bleed from a biopsy in my liver before. And so I know that there's risks when you find things, and incidental findings on scans are actually pretty common. And so for me, what I would actually love to see more than just sending everybody through a scan, because it can catch so many incidental things. And even scanning myself over 4.5 years, I've seen things that pop up and then resolve on their own. So I've learned the nuance that comes from just image modality. What I would love to see is more biomarker blood-based testing. And I think that would be more accessible for a lot more people. And I also think it would help both in the metastatic setting as well as earlier stage patients. So in my opinion, at the very beginning of my diagnosis, I probably really would have advocated for imaging, like just put everybody through a scan. But I think more and more I'm shifting to, I would love to see more blood-based biomarkers developed. And I do think earlier stage patients can contribute to that. Starting biobanks. I know so many patients that probably would be more than happy to run down and give a vial of their blood in order for that to be studied. And I do think that we have a power of being younger and more connected through technology to really amplify efforts like this. In my personal opinion, that's where I would love to see the advocacy go a little bit more.
Thank you. Sid?
Yeah, I don't know how I'm supposed to answer after Katie because she touched on what I was going to say. So I will also reiterate that when we're talking about biomarkers, I think something that isn't touched on sometimes is accessibility, and that the biomarkers, that does allow much easier accessibility for folks. And I will also, there'll be a point that I'll make as well that's separate from Katie's, but also when talking about scans, I follow that same pattern as well, even though it has only been a little bit over a year since I was diagnosed. I too would just, hey, let's just throw everybody through a machine and see what we pick up and let's see what happens. But I have learned very quickly, even though I have not had as many scans as some other folks, that our bodies are filled with a whole bunch of stuff that we just, who knows? But the key is having great doctors and radiologists that know exactly what the bad things are and what the things we really don't need to worry about are. We are human though. So when we see something on our reports that isn't supposed to, or when we see something on our report that doesn't say unremarkable, we tend to worry. Also, something that I would love to see more of, and this is something that I don't know if we can just snap our fingers and improve overnight, but when I tell people my story of how I was diagnosed or kind of those first couple of days, I always touch on the fact that I had a really strong relationship with my primary care physician before this happened. I know I'm very familiar with Katie's story, and that I know Katie had gone to clinics and stuff. And I could only imagine how stressful that is, because with me, I simply walked into my PCP's office and I said, hey, I don't think something's right here. I was urinating blood and I think we should get a CT scan done. And I think we had already had this relationship established that, he knew that I wouldn't just ask for that just willy nilly. So I would love to see more of those relationships bloom. And I don't know the answer of how that happens, because we live in a world where there are biases. People aren't taken as seriously, especially folks our age, and especially women as well. A lot of times women will walk into the doctor's office and they'll just say, oh, you're being over dramatic, or oh, is it? But at the end of the day, like, those relationships, I think, will benefit patients across the board, because that's usually where a lot of patients kind of first start in their journey. A lot of times they don't go to the ER straight. Sometimes it'll be a doctor that'll say, hey, let's get a CT done because this just doesn't seem normal. And then one other thing too, that I think, just awareness. I think one trap that we sometimes get into is we'll say, I got asked the other day, what were your signs and symptoms? And I had really no signs or symptoms besides I literally woke up one morning and I urinated blood. My blood work was always normal. My kidney function was normal. I think Anna Maria touched that her kidney function, there was some abnormal values there. I never had abnormal values. I tend to sometimes err on the side of caution that, yes, if something doesn't seem normal, you need to get it checked out. But I think sometimes if I tell somebody, hey, like I had flank pain, all of a sudden, everybody who might have pulled a muscle, they might just freak out and say, hey, I have kidney cancer. Because you do see that, right? Like we are human and we do that. But I would wholeheartedly agree, though, with Katie, that biomarkers would be something that I would love to see come to fruition. And I think there are some promising things out there. We're not there quite yet, obviously, but I think that would be very beneficial to accessibility and to folks that maybe can't just go find somewhere to get scanned. Because a lot of folks live in medical deserts where they don't have access to. I live 25 minutes away from Vanderbilt, from Nashville. So it's very easy for me to say, hey, go get a scan, but not everybody has that accessibility.
Thank y'all for sharing that. So for our next question, I like to hear from Janelle and Anna Maria. We know that cancer affects far more than just the physical body. So from y'all, I'd like to hear how kidney cancer has affected your mental and emotional health. And if you feel comfortable sharing, whether you sought out any mental health resources and if you thought those resources were tailored for younger patients. Janelle, would you like to kick us off?
Sure, I'd love to. So I was treated at Northwestern Medicine in the Chicago suburbs here. We have a great cancer resource center called Living. They actually offer therapy for cancer patients. So I immediately sought them out, and they offer, I think it was 20 free sessions, which was great. So I used them in the thick of cancer treatment. And then I still have sessions left actually to this day. And I still talk with my therapist, mainly around scans. There's a lot of scan anxiety. Everybody gets scan anxiety. So for me, I'm a big advocate. If you need help, there's no stigma. If you need it, it's there for you. And I completely understand it, advocate for it. We also had somebody on staff that whenever I went in for treatment day every month, they'd come in and they'd ask the counselor and ask, how are you doing? And if I needed any help there on the spot, which was great. So Northwestern's very great about getting those bases covered. As you can tell, kidney cancer, we're not the main grouping with our age. It's usually people that are older than us. So as far as being a young cancer patient, especially with kidney cancer or any cancer in general, I actually found online groups have been very helpful for my mental health, to connect with others and not to feel so isolated, because it is very isolating. You don't really expect to get something like this at 30 years old. Gilda's Club is great. They have Tough Friends Art Club. They do art and trivia. So much fun. Oh, You're So Tough. Chelsea, she does those programs. I really enjoy those. And as well as Cactus Cancer Society. My cousin actually volunteers with them and told me about them. She's a breast cancer survivor. They do art workshops, Lego builds, if you like Legos. It's just a great way for me mentally to know you're not alone and there's other people out there. They might not have the same exact cancer you have, but it's a great way to connect and just get that support that you need.
Yeah. So for me, I had a therapist before cancer. And so I just turned to her and I still talk to her. I've had mental health issues since I was a kid. I had depression, anxiety, PTSD from a few things. So I've always been conscious of mental health, always have treated it. So it was just more of I turned to her as a mental health professional. I think in terms of how cancer has impacted my mental health, and I actually just published a essay about this on my Substack, but I've unfortunately fallen victim to, if you will, the toxic resiliency idea. And so for me, it was just, I was branded a warrior very quickly by my peers and people online. And while I appreciate the sentiment, there was a lot of hiding I've had to do in terms of how I felt and feel. And so here, as I put it in my essay, it's taken me 5 years to realize I am broken. There's a lot that I have not addressed. I actually had a dream the other night about my son having cancer. And I think that's a fear that's been in the back of my mind for the last 5 years that I haven't actually processed. Not to get too vulnerable and stuff, but so that's just been where I have been at, is just I felt very quickly that I had to portray this very strong persona. And again, that could be also my self-righteous avoidance of issues. And so I made a promise to myself this year that I would leverage my art and my writing to heal. And so I've been doing a lot of that recently, actually, with Cactus Cancer Society and Elephants and Tea, which I learned about recently. I'm trying to go to more conferences too. I went to the Escape to Thrive conference that Bag of Cancer puts on. Mallory from Cactus Cancer Society was there, and that was really just life-changing because even it was pan cancer, but it connected you with people who just understood. And I was able to, for the first time, voice one of the big mental health things that I'm dealing with is that I don't feel like I'm a cancer survivor enough because I've just had surgery, right? Like it's been treatment. But being young, being early stage, and only, at least for kidney cancer, only having surgery, when you hear or refer to or whatever you hear, oh, chemo, when I rang the bell, and all of these stereotypical cancer terms. And then you're there and I just had surgery. And I was actually able to be vulnerable about that. I was able to connect with other people, pan cancer from different cancers. You're like, no, you voiced something that I've been struggling with too. I don't know if that answers your question, but that's where so it's a lot of self-exploration, leveraging art. Sorry, I work in corporate, so leveraging is like a big term that I keep using, or I hate using it, but I use it all the time. But I use my art and my writing because in poetry, it's a heal plus therapy.
That's great. Thank y'all so much for sharing that. For our next question, it regards the topic of parenthood and navigating that alongside kidney cancer. So whether you're currently navigating parenthood or you've had to deal with the questions regarding family planning in the future around your diagnosis, we know that kidney cancer does add an extra layer of complexity. So this question's for everyone. And Sid, if you would kick us off and just share a little bit about what being a young parent facing kidney cancer is like and how you've navigated those challenges of balancing treatment and recovery along with the demands of raising children.
I would say I'm still navigating those feelings very much. As much as I would love to say I am an expert on that, I would say I am very much still learning on how to navigate a lot of those feelings. So yeah, I think as I mentioned earlier, my wife and I were planning on trying for a kiddo in December of 2023, and that's when I was diagnosed. And I think when you hear the word cancer, you just automatically, as Anna Maria was saying, you just have all these contemplations of what that is and what that isn't. And it's like, oh, we can't have kids. You can't have kids. And I remember distinctly having this conversation with my wife about, and for those of you, my wife is a nurse practitioner, and really from when I was diagnosed, she was very much, we're just going to get this out of you and just move on with life. And I was like, I wish I could have that attitude. I did not. And so with me, I think after we found out that my wife was pregnant, it was a little bit different because there was such a whiplash effect from going from one end of the worst thing that's probably ever in my life to then maybe the best thing that's ever happened in my life. So there was a very strong whiplash, is how I would describe it, going from that to the other. And I think, and I also had a therapist before my diagnosis, so we're delving a little bit into the mental health side of things here with being a young parent. I talked a lot about that with my therapist, with Rachel as well, my wife, who was very understanding of kind of the feelings that I was having. And also the fears, right? I think I just went through this diagnosis. My doctors are very optimistic. I'm just like, what if this comes back like a year from now? And I just had a kid now we have a 2-year-old. What am I doing here? So all of that is to say that there are a lot of big feelings there that I'm still currently digesting, but for advice purposes and how I would say going about those, whether or not you are planning on having a child or you already have children, I think one of the biggest things that has helped me navigate a lot of these feelings since we found out that we were having a child was seeing that life in a weird way does move on post-diagnosis. And I don't know if that's 100% a good thing or 100% a bad thing, but for me, it's helped me be that it's cliche to say, but as a chapter, as like that was a chapter and now I have this chapter, and it's helped me a little bit continue to move on. It's still very fresh in my mind because it's just now a year and some change since my diagnosis and surgery. Our child was born not even a year from my surgery. So it was very much a quick turnaround. So all of that is to say that I'm still freshly working on a lot of those feelings. I'm sure others here will have some great insight as well.
Yeah. So for me, I don't have any children, but very similar kind of to Sid. I was planning to have kids when I was diagnosed. I was actually going through the final diagnostics after I had been dismissed for a year and a half. I was going through pursuing new primary care physicians and everything to try to make sure that it'd be safe for me to have kids. And that's when we ended up finding the cancer was in that time period. And so for me, that was a very big shift. My husband and I got married just 2 months before I was diagnosed. So going from picking out baby rooms to picking out cancer centers is a whiplash. It is really difficult to try to navigate and then also to try to come back from. For me, especially due to the rarity of what I had, I don't feel comfortable having children, but that's just a personal choice. And maybe one that I change down the road as far as looking into fostering or adopting or something like that in the future. But because I was stage 4 at diagnosis and had such a large tumor burden, I don't think it was anywhere in the mind of any of my physicians to have that conversation. So there was no fertility preservation treatment I was on. Technically, you can have kids. I believe it's after 4 months, you can try to get pregnant. But there's so many unknowns. There's so few people that have been on that medication at my age that for me, I went from this world where I was picturing what life would have been and raising a family and kids. And all my friends, my best friend of over 20 years actually told me she was pregnant the day that I was telling her I was moving down to Texas to move down to MD Anderson. And so there's this separation of worlds that I think came from me because I didn't end up having kids. So for me, that new chapter wasn't the chapter that I was pitching or envisioning before I was diagnosed, but also I couldn't even begin to imagine the joy that I have in life now and the gratitude that I have for the things that I'm doing now. So for me, that was a shift. And so I'm not there mentally to think about those things where I'm currently we've just decided not to have children. But that's how those conversations have shaped for me being diagnosed. So yeah.
My conversations were similar with my husband. We went from being 30 and recently married to have a stage 3 cancer diagnosis. And then it came back. The next year was mets to my lymph nodes. So those conversations were more so, what will we do if we can't have a baby? So we did the IVF before I started immunotherapy, which was all me advocating for myself since that wasn't really brought to the table until I brought it to my oncologist and I wanted our family in the future and what were my options for fertility planning. But our conversations turned into What if I can't? Do we adopt? What are our options? So it's like very deep conversations. And my husband's been my support, my partner. He's so thankful for everything he's done. I was just open with my oncologist throughout the whole treatment. So we decided that after my treatment was done in February, I had the green light to do an embryo transfer in May. I actually was naturally pregnant in April and had my son in December of 2023. So we were lucky to have that. But of course, it's always in the back of your head. What if it comes back? What are things like that? So anxiety never really goes away. I did the genetic testing. I know mine's not genetic as far as the research that's out there right now says it is not. It's just hard. It really changes your whole mindset, especially when you're so young, because it's not really something you think you're starting your family and you're starting your life with your husband, and cancer just throws you for a curveball. Obviously, my son's 15 months. He doesn't really know any of the situations yet. I know there's books out there and resources. I think Chelsea Gumma's read a really good book to introduce kids to the idea of my mom has cancer, if anything like that happens. So I know there are resources like that to depend on, but it just throws you for a curveball. But I'm happy. I'm so grateful for my son. It took a lot of work to get here. I went through the cancer and then I got to NED and then had him. So hopefully, obviously, everything keeps going well and maybe more kids in the future. We're not really sure yet. Got our hands full with one, but really just advocate for yourself. I know at our age, it's not something they're thinking about in their treatment plans.
So I kind of bridge these experiences. So as I said, my son was 5 when I was diagnosed. So he was still very young and it was very traumatic for him. And so very quickly, I try to find him therapy. Wonders and Worries is a group down here in Texas that provides free one-on-one and group services to kids whose parents have or had cancer. And so I got him in sessions with that. And I'm saying this all for a reason, right? And then through that, I got him connected to Ketzum, which is a camp and year-round programs for children whose parents had and had cancer. And he's still in that. And he still goes to that. It's been hard. It's still hard to parent when you're a young person with cancer because you can't stop feeling guilty for making your son scared, for making your kids scared. And I'm going to cry because this is one of those things that I do cry about. There was one time where he was screaming for me. He didn't know where I was. And like in his mind, I was dead. And I was like after the first time. And he told me a couple of years ago when I had the thyroid cancer that he follows me around because he wants to spend as much time with me as he can because he doesn't know if I'm going to live. And maybe if I didn't get thyroid cancer, it'd be a different story at this point. But with all the different health things that's come after that, there is no guarantee for me. I can't guarantee that there will be something that will happen that will make it impossible for me to see my son grow up. And so I know I'm 42, so I'm technically aging out of the young, but even at 42, my son's going to be 10, which I don't even know how that happened. I don't know how he grew up. I don't know where that even occurred, but he's going to be 10. And so that's like in 8 years, he's going to graduate high school. And before I turned 40, I thought I was done with cancer, and then I wasn't. And then before I turned 42, sorry, I'm not 43 yet. Before I turned 42, I thought I was done with cancer, and I'm not, right? Like it might have been precancerous, but it's still something I have to watch out for. And I have to pray that doesn't happen again and come back again. So it's just this constant idea in the back of your mind that, am I going to see my kid grow up? Am I going to see him turn 40? Am I going to see him turn 42? Sorry, it is something that I don't talk a lot about. I do. I don't. I can't talk about it without crying. So I'm sorry. It's a panel we're supposed to be raised. I think, too, at the time I was diagnosed, my partner and I were talking about possibly having our own kid. And I know very quickly said, no, not at your age and not with one kidney. And I'm like, oh, I won't be able to have a child. And then a year or so later, it was like, oh, that was incorrect. Should have never told you that. You could totally have a kid with one kidney. I'm like, at this point, it's a little like too late. I had radioactive iodine. I have no idea what that's done to my fertility. I think one thing people didn't talk about a lot when it comes to that fertility conversation is when you are not able to have a child or your ability to have a child is in question, you can feel less like a woman. And I obviously a cis woman, right? Like obviously in that way, but you can feel like your womanhood was taken away from you. And so that was something I think I've struggled with over the last 5 years. At this point, it's like it wouldn't make sense to naturally have a second child. Makes me like sometimes feel really bad. I'm like, oh, not only did I fail as a woman because I got kidney cancer and I didn't get a woman cancer, like now I can't have, which I think is another subject that we totally needs to be talked about. But now it's, oh, now I can't have, like now my body is failing me in all these different ways. And I'm going to go off camera and explain myself. So I'm really sorry for crying.
All is good. Thank you so much for everyone for sharing that about parenthood. I really appreciate it. As we move into our next couple questions, I definitely want to get to talking about awareness and advocacy and talking about solutions to some of the challenges y'all face. So this next question is for everyone. I'd like y'all to touch on any advice that you might give the younger people who have recently been diagnosed, or any advice in speaking to their families about their diagnosis. Sid, would you like to start us off?
Yeah. So I think when I think back to when I was first diagnosed, or when I had a tumor on my kidney and we were pretty sure that it was cancer. When talking with my family, and I think a lot of folks here would agree that everybody here knows their family dynamics, right? And the breakdown of how folks are going to take certain news, and then maybe how to talk to folks. Like I know with talking with my dad, I was pretty direct in what we were looking at and what could possibly happen and what my doctors think will happen. And I think as I said previously, I'm pretty a humorous person. So I tended to fall back a lot on that during and leading up to my surgery. And then also post-surgery as well, with going through my scans and scanxiety. I think also there's this, what's the term called? People use the word ghosting a lot, right? So you'll have friends that are maybe internalized that after you have been diagnosed, some people tend to drift away. Maybe not, they could have been close friends, they could have been maybe just acquaintances, but you will see people drift away here and there. And I think that can be challenging as well, because you feel as if like you already have this distrust in your body. There must be an Amazon person at my front door or something, because my dogs are going ballistic. Regardless, there's this thing with cancer ghosting that you see friends in your life, or even family as well. This isn't just exclusive to friends or acquaintances or people that you work with, that for some reason that cancer topic just makes them uncomfortable. And I think with me, I've tried to be as open and honest with people in my life about my diagnosis and what I'm going through. And I'm a fairly open person. If somebody asks me about, hey, how you doing? I will be pretty straightforward with them. Oh, I have scans next week. I'm fairly worried. Like I will be pretty open and honest with them. And I've found that tends to let folks see a little bit more into what I'm going through as a kidney cancer survivor, if you will. And I think that's helped a little bit with me talking to people about my diagnosis. And I think that's where I would leave it at. I think it really depends. Like I said, your family dynamics and your friendship dynamics, everybody has different dynamics with their relationships. I picked and choose also like who I told right at the onset versus who I told maybe a week before my surgery. I had obviously my very close family and friends. I told pretty much the week that I found out I had a tumor, and my tumor was fairly large, right? This could also be different with somebody who maybe there was a 1.5 mass and they think it could be just like there are all these different things that could go into that type of conversation with your friends and your family.
Yeah. Before I answer that question, I want to pause for a second and give quick kudos to Anna Maria. I know that was a very vulnerable moment for you and you apologize for that. But I want to say that I think you sharing that and being vulnerable is incredibly important, especially in a panel like this, because it highlights the very unique dynamic. And these are the burdens that you carry with you throughout every waking second of the day, right? These are the mental capacity that you have to carry around with you as a young adult who has faced cancer. And I know you apologize for that, but I want to give you kudos for, I know it's hard to be vulnerable in those moments, but I think it's so important because it's a very important point that I think a lot of people struggle with and it's not talked about. So diving into what I would recommend or wish I would have known when I was first diagnosed, or wish I would probably share with my family or families for those that are recently diagnosed. I think this one's kind of a tough topic because cancer affects everyone, right? So it affects our loved ones. And it's really hard when your loved ones want to be there for you, but are saying some of the things that are very unhelpful and make you feel more isolated. That's never their intent. They're always trying to show support, but sometimes it can make you feel more isolated if it's, for me, it was, I mentioned briefly of how sometimes my physicians were the only ones who understood what I was going through, my physicians and my husband, right? And a lot of that came because they knew what these treatments were. They knew why they were choosing these decisions, making these decisions. For me, I didn't have surgery at the beginning. They knew why I wasn't having surgery. And it was really hard for me to try to communicate that back to family and friends over and over again. To those appointments are so short. Like, you don't get a lot of time with your physicians. And so when you get a million questions fired at you that you don't even have the answers to, but then you have to defend your treatment plan and do that at the same time of, I don't want to offend this person that loves me and cares about me, and they're asking me these questions or giving me these recommendations because they care, whereas I have all of this additional context, but I don't want to make them uncomfortable by talking about it. And there's just so much to juggle. And probably my advice